again, if you're the one that's kind of in that situation, like ask for your own help and support because you need that support too. And have all those people kind of on the same page and ready to help when the time is right.
Now, I know, mental health and the mental health crisis here and also internationally, it's not something that's just in the US. It's something that's really drawing a lot of attention lately. And I think we're learning a lot more about it. And I know that one of the things that you did was an in-depth study, correct?
No, it wasn't my study actually. This is a study. I think it was actually done by the Kaiser Permanente insurance company.
Okay.
Um, yeah, and it was very, it involved a high number of participants that took place over a long period of time, and it was replicated many times. So this is like in my field of social work, this is a foundational study, and just in terms of the methodology and how many times it's been able to be replicated and proved how sort of accurate it is.
Okay, awesome. And this is something that you kind of base some of the things that you're talking about today would be on this. Okay. Can you elaborate on some of the things that were found in that study, what it has to do with like childhood trauma, how that affects adults and that type of thing?
Yeah. Actually, I think one of the things that's really interesting about the history of this study was that the reason it was conducted was because Kaiser found out that there were a number of people in their pool of insured patients that were using a tremendous amount of medical care. They called them like super users. So it was a small fraction of their population who were using, a very, very high amount of care. And obviously for an insurance company, that's expensive for them. So they wanted to think, try to figure out why that was happening. So this was actually about medical care, not even mental health necessarily. So, but when they interviewed the participants to try to find out what they had in common, it was very exhaustive, and they looked at a lot of factors. And I don't think that they were expecting that it really came back to childhood abuse issues, essentially, that they were able to narrow the commonalities down to about 10 factors that happened very, very early in these people's lives. And that it affected their later health outcomes, even cancer outcomes, diabetes, obesity, heart disease. All of these sort of chronic health conditions were much more prevalent in this population of people that had experienced childhood abuse.
Wow, that's crazy. I mean, to think that that would come back, so late, so long, but, in life, and you would find that that would change or alter your course in life as far as your health conditions and stuff. That's amazing.
Yeah, and
Now,
that's a big part of what I want to show, because it also does affect mental health. It affects the rates, has a tremendous effect on the rates of poverty, mental health, likelihood to go to jail, educational outcomes. Yeah, so it's like comprehensive across a lot of different areas of someone's life.
now, I know that's something that you work with now, correct? What do you now in your line of work? What do you see? What are you seeing in your offices and online actually with your clients?
Yeah, I mean, I have an outpatient therapy clinic, so it's, we get a lot of people that have experienced abuse, essentially, and they're all different age ranges. We work with, young children, we work with older adults, and everything in between. And it's pretty broad because, like I said, outpatient is just kind of whoever is seeking services. But a lot of them, yeah, have experienced, difficult family environments.
And now, how can we as a society help prevent or stop child abuse and neglect in the household?
Yeah, it's a tough question. It really is, because and it's not easy because it's happening in people's homes, right? So it's like it's hard to get it's hard to introduce yourself into a person's home in a way that makes sense and is realistic. Sort of the message that I want to share in a way is that there is not an easy way of doing it, for one. Um, nobody else is going to do it besides, you and me and all of us together. The government is not, it's not set up to do it effectively. Whatever the government does is going to be sort of the least efficient and the most bureaucratic, right? And so it's kind of a last resort. And I think what I want to say is, that we, all of us have to do what we can, because it has such a tremendous impact on every single individual throughout their whole lifespan that experiences this. And it affects everyone in their lives, their family, their children, right? And so I think part of it is just to tell people that helping one kid is enough. If you can help one family, if you can help one kid, it's a tremendous impact that reverberates throughout their whole life and the lives of their family. And if you can help two, like, it's a miracle. Okay. Just, so it's just like, we all have to get involved, instead of talking about things that other people can do, like we do it, you do it, help one person.
And be that person. And I know this is something that wasn't really touched upon, but a lot of times, like, abuse are the people, like the kids that are being abused, the abusers, the people that are taking care of them. A lot of times it might not be like something that they're doing like on purpose. Like, this is something, maybe, do you find that some of the people that are like doing the abuse were abused when they were children? Like, this is like a trickle down effect type of thing.
Well, yeah, because like all of the things that I was just kind of going over, right? They have all these outcomes, and one of them is that they're more likely to be, abuse their own children. And that's the other reason why the impact is so huge, because it can, if you can help that outcome for one person, it's going to affect all of the generations after them, and all of the, in the other way too. Obviously, the things that happened to people 50 years ago are still affecting everybody, today.
And what are some of the red flags to look for in like a child being abused at home?
I'm gonna put it a little bit differently, right? Because I'm talking about how to help these people.
Okay.
I mean, there's red flags that you see later on as the kid gets a little bit older and say goes to school, right? Because they really struggle with peer relationships. Is one of the more obvious things that you can see. They struggle to, function well in the classroom. That can be from abuse. And there's a whole range of things that like teachers and social workers know about,
Okay.
how these kids behave and what they look like. But by then, there's already been a tremendous amount of damage that has been, that has occurred in this child's life. So I'm talking about going backwards. I'm talking about before it happens, stopping it before it happens. And I think the main thing to think about is really that almost all of this abuse, like 90+% of it, occurs in families where there's a parent that's struggling with addiction to drugs or alcohol. There are other things that can cause, there are other sort of situations where the parents will end up doing this, if they have a severe mental illness, maybe. But if we really focus on parents who are struggling with substance abuse and they have very, very young children, like, that is the most efficient place to intervene. Or, pregnancy, it's like that it starts affecting the child in utero, that if a parent is using drugs or alcohol, by the time they're born, there's already been a tremendous amount of damage. So it's really about that. It's about finding those parents or about to become parents, the young adults who are struggling with substance abuse, who may suddenly become a parent on purpose or by accident. And those are the ones help that will cause the most impact as quickly as possible.
And now, from your expertise and knowledge, what are some of the things that can help these people that are going through, like you're saying, like mental health issues or drug addiction issues?
Melissa, it's just not an easy thing, because it's like you have to really make your own, sacrifices to involve yourself in these people's lives. And it's not easy. It can be punishing, because sometimes they don't want help. And that's kind of the other message I'm saying is just because it's hard, just or even sometimes impossible if they refuse help, it doesn't mean we should give up because it's just so important. Um, but yeah, you have to get to know these people. You have to have a relationship with them. They have to know that you care about them. And that's the starting point. If they don't, if you're not involved, if you're not there, if they don't think that you care, um, there's nothing you can do. If they think that you do care, if they know that you're there, if they know that you're present and want to help them, then there's sort of this timing issue that people that are struggling with addiction or mental health problems, um, sometimes they're often in a state of refusing help and being in denial about their problem, but they will also have times where they realize that they don't want to live like this anymore and they're ready to do something about it. And so you've got to really catch that person at that time and be available to help them get, whatever help they can at that point. It doesn't help, but enabling is something you don't want to do. If you know somebody in this situation, you don't want to do anything that helps them continue their addiction in any way. Any money that, if somebody's in a severe addiction, any money that you give them will immediately go towards fulfilling that addiction more. And it doesn't help them. They won't use it for what they need, including their children, unfortunately. Scolding them and telling them how awful they are, criticizing is not helpful because that just kind of fuels the negative self-image they already have about themselves. They know how awful they feel worse about themselves than you feel towards them already. So you just have to hang in there, let the person know you care, think about, I think one of the things I do is I really think about how underneath this addiction, there's just a human being, just worthy of love. A lot of times they have these incredible qualities, incredible hearts that come out when they stop using, even for a short period of time. It's like, oh my gosh, this person is just worthy of help and love and care. So you have to understand that what you're seeing is not the whole picture, that underneath the surface, there's a lot more there.
Very true. Because it's like that addiction, like it masks the person is underneath there, but a lot of times we can't see it because it's just, they're driven by the addiction. You don't see the person anymore. But I know from experience, it's like once that is kind of away, then you see glimpses of who that person was, before. And so it's, and it was also, I was going to ask you, what are some of the ways, like when you have those windows of opportunity and you see that maybe they're looking for help, what are some of the ways you can kind of guide them?
Yeah. And again, another kind of, it's actually pretty, like if you know somebody well and you know that they may be like available to get help in the future, it's really good to know what you want to have set up ahead of time. Like have the place you're going to go. Don't try to make a plan on the fly necessarily like that. I think one of the important things that my experience has told me is that if somebody is struggling with addiction and they continue to be in the environment where that addiction is taking place, including around other people who are, sharing the same kind of problem, they can't do it. They can't stay in that environment and get, clean if the people in that environment are not going to join them, right? So it's like they have to go somewhere else, whether that's a facility, live somewhere else. I mean, they have to get out of the environment where the addiction is occurring because otherwise it's too much of a kind of a black, hole that sucks them back in. I think getting the help of a therapist can be useful. You have to find somebody that is going to be a good fit. I think another thing I really like to tell people to do that are, say, preparing to help a family member, right, who may be ready, is that person needs support too. Like, let's say it's a mother and there's a child that are struggling with addiction. Like, the mother needs to be surrounded with her own resources and help and support for other people that can help her or intervene or show up or make phone calls. Or so it's kind of like it has to be like a bit of a team that all works together to help the person. So again, if you're the one that's kind of in that situation, like ask for your own help and support, because you need that support too. And have all those people kind of on the same page and ready to help when the time is right.
Yeah, that's important that it doesn't fall on, yeah, because you know, have all that burden, and that is extremely stressful.
Yeah, if it's one person, right, it's overwhelming. That person, they're emotionally being pulled in a lot of different directions, from sadness to anger to terror. And so, terror of like what could happen to the person if they don't stop, sadness of what they've lost, anger at the way it's kind of what's become of their own lives. So yeah, that person also needs a whole team of, people that know what's happening, that are, on board and ready to help.
And now, anything else that you'd want to add as far as, I know now you want to talk a little bit about what you do with your online services, like how do you kind of help and step in? What are some of the things that people can?
Yeah, the company that I have is a therapy company. It's mostly based in California. We were almost all online we were all online at one point. We actually have a couple offices now in Southern California. Yeah, and I really focus on trying to bring on fantastic clinicians, and honestly, there's a lot of them out there, and they just need an environment where they can be successful, where the kind of the bureaucracy hopefully is taken out of the picture, and the therapists out there and the social workers out there, they're dedicated to what they do and getting better at it and helping the people that they can. So those are my employees, and they, are fantastic. And the challenge, I think, is on my end, is just creating an environment where other things don't get in their way, and just kind of letting them do their job, along with providing some, really good training, because they need training, and they need a community of other therapists that, speak the same language as them and know how to support them. So yeah, those services are available for residents of California, particularly, and also we serve people with Medi-Cal. So that's kind of our population. I'm looking at maybe expanding out to other states, right? But right now, that's what we're doing.
Okay, that's amazing. Do you find that there's more, I guess, even after COVID, I think we have more online services available where we didn't before? That's another thing.
I think that's true. I actually started doing online services just before COVID, and it's super convenient for people, right? Like the therapists really love being able to stay home and work from home. And a lot of times the clients like not to have to commute, or if they let's say they live far, away from a place where they could access therapy, they can do it without having to drive very far. If they live in a very dense area, they can do it without having to get back in their car and commute through traffic. So there's a big convenience factor there. But, part of the reason why we've opened up a couple of in-person locations is because there are now so many therapists that work online that it's actually hard for people to find therapists that will meet with them in person. And especially we started off really saying, like, we can't help these little kids like on the computer. We have to be in the room with them and provide sort of a different environment.
Because that's a little bit different when you're working with children, I would imagine. You have to be a little more hands-on type of thing where you're...
Yeah, you need, people do it, and some people do it really well, but you do need like play is the language of children, and so we talk to them through play, young kids, when we're meeting with them, and you need toys and to do that, yeah, and just be a little bit more in person.
Right, kind of open up. My daughter, she learns better in person. We do online, but it's like it's much different when someone's sitting there working with her than when it's online. I don't know what it is. It's the disconnect for some reason, but as we close this out, I know this is a really important topic, and there's so many parts to it. I mean, you have the people who are, have the mental illness that are dealing with addiction. You also have the, neglect, because I know with the children with addiction and mental health could be neglect is involved. So it's not just abuse. Neglect is also a part of like just not having that parent or not having that person. Is that another aspect to this?
Yeah, actually, like I was saying in this study, there was 10 kind of categories. I think of, I mean, I guess I think of neglect as a type of abuse, but yeah, it's like if you have a young child in the home and there's just nobody paying attention to them at all, that's really not good for their development. So there's sort of physical neglect, which is, they're not being changed and cleaned and fed well. And then there's emotional neglect where nobody's really paying attention to them. Those are both categories of abuse, along with, actual like physical child abuse. And then the other categories were, actually like a child witnessing domestic violence in the home is another really traumatic thing for them. Yeah, so those are some of the categories of things.
And just to wrap it up, because I know this is like another probably like a difficult aspect to kind of elaborate on, but now for the children, I know we want to catch it before all of this occurs. Now for children who have, seen abuse or, domestic violence or experienced some of these things, can they be helped? Can things help them to have a more normal adulthood and recover from that?
Definitely. I mean, the earlier the better still. We do work really successfully with young children. And so that's definitely something, one of the things that I did earlier in my career was work on reuniting children who had been taken away from their families, usually because of the parent being, having substance abuse problems. And when I met them, they were clean. They had gotten sober and were ready to work on getting their kid back. And so you rebuild the relationship with the parent. So the younger the child is, the more the leverage that relationship with the parent has. And if the parent is back, able to parent again, and you work on rebuilding that relationship, that has a tremendous impact on younger kids. Yeah, I mean, we work with all ages, so there's sort of different things that work at different ages. Family therapy, again, for younger kids. And then once you get into adulthood, or late teens, there's individual work that can happen too. I really believe in, I guess, finding the right therapist, finding a really good therapist. Don't be afraid to shop around, and make sure you have a good fit. Yeah, because I guess here's another thing I'd like to add about that. If a lot of times parents would kind of like, I don't know, if a parent is struggling with, say, a teenager's behavior or mental health, the parent feels desperate and wants to get them help. So if the parent kind of coerces a kid into therapy, I feel like that, I'll just say, as the therapist, that can be a really difficult position, because like really once they get in the room, you can't do any therapy with them, and you're like, why are you here? And they're basically like, eventually they may tell you that their parent is making them come. But the problem with that is that it sort of sets up this dynamic where they resist going to get the help that they will maybe eventually need down the road. So you don't want them to have a bad experience early on. So find the right person. Don't force people to go, because it's not the same thing as actually being willing to go. So I think those are some of the things I'd say about that.
Okay, so it's important to maybe have a couple meetings, like, even for an adult, maybe one, social worker or therapist might be a better fit. So maybe you want to have a couple meetings, see if you connect in a good way.
Yeah, and don't be afraid to ask a lot of questions up front about how the person is going to help you. There's all kinds of different therapy out there, a lot of different kinds. Some of it I think is more helpful than others, but I would ask anybody, basically say, okay, like, this is my situation. Have you helped other people that have had this same problem? How did you do it? What happened? how confident are you? And if they say, well, I'm not sure, or like I've helped a couple of people with that. Like we all have different specialties. Like we all have different populations, I think, that we are the most comfortable and effective with. So make sure that whoever you're working with can explain clearly how they're going to help you with the specific problem that you have, and that they seem confident and clear about how they're going to do that.